Welcome everyone to the first dialogue of Generations for Health. We are very happy to have you all here today. And first of all, I would like to thank our experts to make time in their agendas to join us today. And I would also like to congratulate our youth delegates to dare to raise their voices in representation of the youth on something so important as it is the access to healthcare. Generations for Health was born to empower and to create a space for the youth to bring their views on global health. Like many youth, for a long time I've been scared of raising my voice, and I felt that no one wanted to hear what I had to say, until someone gave me the opportunity to be heard. This initiative was born out of my desire and the desire of my team of giving other young people the opportunity to raise their voices and to be empowered to change not only their realities, but those of the world. Our first dialogue will be focused on access to healthcare during the COVID-19 pandemic. This dialogue will be divided into 3 different panels: Determinants of Health, Global Health Governance, and the Role of Youth. Each panel will be conformed by 1 leader in the field and several youth delegates. I would like to remind that all participants in the discussion are solely representing their personal views and not the ones of any particular organization or institution. Before starting, also, I know you are very excited, but I would like to remind a couple of important rules in order to guarantee the flow of the dialogue. Remember always to respect the speaking time. Keep in mind also that this is a safe space for dialogue, so no hate speech or disrespectful manners will be tolerated during the discussion. Celia, here in the meeting from our team, will be the focal point for the protection of the minor. So in case any of you have problems or is facing a difficult situation, you can refer to her. Pablo, Rami, and I would be the facilitators of the dialogue. And finally, I would like to share with you the hashtags that we'll be using for the dialogue today, in case you want to share them in Twitter or anything like that. The hashtag will be hashtag Gens for Health and hashtag Shaping the Future for this discussion. And we will be ready for this. We will be starting with the first panel, which is Determinants of Health. So Pablo, whenever you want, you have the floor.
Thank you very much, Daryl. First of all, welcome everybody. Welcome those of you who are here. Welcome those who are watching the streaming from home. I'm gonna share the screen real quick. So I'm Pablo, and I'll be moderating the first panel today about determinants of health. I will try to give a brief definition on what we consider from Generations from Health about determinants of health. However, first of all, I wanted to introduce this fantastic panel we have with us today, and thank you all for participating. So first of all, we got Dr. Unni. He's an assistant clinical professor at the Yale School of Public Health. He was a medical director of the Doctors Without Borders campaign for access to essential medicines from 2005 to 2007, and co-founded Vivo, which is an organization that works towards overcoming and preventing traumatic stress and its consequences. He has therefore been a humanitarian worker and a public health professional for more than 2 decades, and his favorite fruit is lemon. Then we got Fatima Bashir. She is from Nigeria, but she's currently living in Cairo. She has a bachelor degree in psychology, and while she was pursuing her bachelor, she was simultaneously completing the paramedical track. She is passionate about health and hopes to somehow contribute to improving the medical healthcare system in her country. Then we have Mokhtar Malas. He's from Syria. Currently, he's living in New York, where he studies medicine. In the past few years, he has volunteered with different NGOs in Greece, Lebanon, and Jordan, serving the refugee population. His favorite food is watermelon. And last but not least, we got Iris Blom. She's a medical student at the University of Amsterdam. She has been active within the field of global health with a special focus on climate change, and she has organized national advocacy on this topic, as well as attended the first ever UN Youth Climate Summit on COP25, and her favorite fruit is papaya. So once again, thank you all for participating. I wanted to give you a first really brief definition of what we consider social determinants. We understand that person's health is determined by multiple external factors. Those are called determinants of health. Social determinants of health consider political, economic, and social forces that influence circumstances in which people are born, they grow, they live, they work, and they age. Therefore, we could have a lot of examples such as employment, housing, nutrition, education, early life development. So if those are missing, it can only affect a person's health behavior, but also their access to proper healthcare. So I wanted to, let me stop sharing this screen. No, sorry about that. Technical difficulties here. So I wanted to start asking to kick off the debate a really short question, and I'll ask you to be narrow here, 30 seconds to 1 minute. Why do we need to talk about determinants of health? So if anybody wants to take the floor. Iris, you, for instance, if you want.
Sure. I can get started. I think you touched upon the importance of determinants of health already for a bit there. I think when we're talking about social determinants of health, it really, when you think of any type of global health issue, or even any type of health issue to begin with, these determinants of health influence them in a way. You've already given us some examples of that, and there's many more, as you said, that we can think about, but especially when we think about the pandemic that we are in currently, it is obvious that the determinants of health very much influence how your risk of infection, for example, your ability to work from home, for example, your ability to get healthcare when you need it. So our pandemic really also illustrates the importance of social determinants of health.
All right, great. Yeah, thank you very much. Mokhtar, if you want to take the floor now and give us your opinion on this.
Of course. So thank you, Pablo, for introducing this topic. And just to follow up on what Iris has said, a lot of our issues currently that we're seeing during this pandemic has affected different people in different ways, such like minorities, for example, the prison population, homelessness. There are certain groups of people that have been hit harder than before, and this is basically predetermined by the type of living situations and the social aspects that they had growing up. And these issues have not just come out of the blue currently. Those are issues that's been going on for the past few decades. And it's just that we haven't acted in a proper manner to be able to prevent those communities to be hit harder. So I think, like Iris said, there's a lot we can do to be able to discuss how to prevent the chaos that we've seen recently during this pandemic.
Great, thanks a lot, Mokhtar. Fatima, if you want to take the floor now, don't mind.
Yeah, thank you. So I think, like Mokhtar and Iris said, it's basically been, the health determinants have basically highlighted differences across different communities, especially within countries, between countries, I mean, sorry. So we've seen certain countries have very different, being affected very differently. And most of it I would attribute to the health determinants. So I think this pandemic has kind of helped highlight the differences and how impactful these differences can be.
Right, really interesting. Dr. Unni, if you want to give us your perspective on this.
Yeah, can you hear me? Yeah, so it's great being here. So it's a really great topic to start off with, because we tend to think of health in technical terms, but ultimately it is a political. Health can only be fixed politically, right? So, for example, if you're an American citizen, the health you would experience if Trump is president, and if Bernie Sanders is president, will be very different, because it is the ideology that goes behind how you conceptualize health is very important. So we all know about the differences, the racial disparities, the gender disparities that exist within countries, right? But there's a writer called Rana Dasgupta who's writing a book called After Nations. The book will come out sometime next year. And he says that citizenship is one of the fundamental forms of injustice in the world. Because if you're born in Congo and if you're born in Finland, your future is almost all determined, right? So you can talk about inequality, you can talk about inequity, but your citizenship and where you live and where you grow up sort of determines your health outcomes and other outcomes to a large extent. And when people try to equalize that by moving to a country to get them the advantages, they are of course stopped and sent back, right? So we talk about equality and equity, but we talk of it within borders and not globally. So that's also, I think, something we need to think about going forward, that do we need to reimagine, revision a world where no matter where you're born, that you can somehow gain access to the advantages and the services that will allow you to compete, not just locally, but you have the same advantages to compete globally. So I think we also need to start thinking about determinants in a global sense rather than in national sense and local area sense.
All right, really interesting. Thanks a lot, Dr. Unni. We will sure be looking forward to that book. I was going to ask, from your personal experience and relating to, because you have all brought up different, this notion of healthcare and determinants of health being determined by geographic, gender, racial, all those type of things. So I want to ask you, is there any determinant which you think is neglected or overlooked in that sense? Fatima, if you want to start, sorry.
In terms of, I think it would really differ from community to community. But I think we can notice that across different communities, you can clearly see that you can have one or two or even more than that determinants that kind of missing from certain communities. So I think it really does differ.
Yeah, totally. Mokhtar, if you want to add anything on that.
So I think from at least the point of view of the United States, a major issue that has been that we, like Americans, have been facing for the past decades is healthcare. A lot of people don't have access to a good healthcare system and good health services, and this is unfortunately due to the fact that we do not have a good healthcare system that is able to guarantee the right to be able to get treated for every American citizen. I think the economic determinant of health has been a major factor when you talk about the pandemic currently. And there's that thinking that we have to see for the future, especially, let's say, for example, if a vaccine comes out, how do we think of, like, how are we going to fund this vaccine? How are we going to be able to provide every citizen for that vaccine? Because in order to be able to move forward, you need to have a large portion of your population be vaccinated, for example. So the economic factor has been a struggle, I think, mostly in American politics. And that is something that we need to work on in the future.
All right, really interesting. I was saving it for later on, but I think it really comes into consideration here. So we carry out a survey in order to prepare for this debate. And this was one of the questions that we showed. What would people consider the greatest barrier to accessing healthcare services? And regarding what you, Mokhtar, said, yeah, 80%, I don't know if you can see it from here, but 80% of the people think that the greatest barrier to access healthcare is high cost care, sorry. So I think that really, sorry. So I don't know if you want to add anything on this, but this is once again a survey we carry out to prepare for this. Sorry. So, any comments on that you would like to add?
So yeah, I mean, just to follow up, like for example, from an American perspective, approximately up to 70% of the US population live paycheck to paycheck. So a lot of people are forced to make a decision whether they want to spend that money on some healthcare related issue that they need a doctor to see, or save up for bills and mortgage or rent or whatever they need to pay to be able to, sustain their life. So that puts people at like a greater risk, anxiety, and this is obviously something that we really need to work on, at least from the American standpoint.
Yeah, totally. Really interesting. And I want to ask you, Iris, because you have been working, right, and studying about how to combine this global and local level of determinants of health, as well as what Dr. Unni said. So I don't know if you would like to add anything to this.
Yeah, I think your question is a very interesting one because you mentioned both neglected and overlooked. And when I think about neglected, I feel that most, if not all, determinants of health are currently in most countries around the world neglected, at least by politics. But when I think about overlooked, I would just like to add one more determinant that I find very interesting that's also very important in the Netherlands, which is where I live, is the concept of health literacy, which is someone's ability to understand health information, but also to use that information for their own health. And I think that is a concept that I would call an overlooked concept rather than, and that leads to being neglected. But I think neglected applies to most, if not all, determinants.
All right. Yeah, definitely. That's a really good point. I also wanted to ask, and changing kind of moving out, in order to address these determinants of health, how do we combine these short-term gains? And I think this is a debate that has come up here with COVID-19. How do we, or where do we focus, short-term gains or long-term solutions? I don't know if Dr. Unni, maybe if you want to add something on this question.
So before we go into that, I just want to make a point about the economic determinants that we talked about. It would be a mistake to focus too much on the economics or the money, because of course we need money to get the job done. But if you look at COVID, some very successful responses have come from countries and states that are not very rich. So for example, Vietnam has done very well. The state of Kerala in India, where I come from, has done exceptionally well. Senegal in Africa is supposed to be doing quite well, right? So what is important is that you have authorities that are responsive to the needs of the people. They are reacting in a timely fashion, but of course, that will only work if there has been some sort of backbone or consistent investment in health over the years. It is possible, I believe, to provide reasonably good healthcare at very low cost. But that comes from a certain, you have to have stamina as a society to fund healthcare for over a long period of time. So that's political will, right? If you don't have the political will, then, so for example, now we are in a situation, 2014, Ebola outbreak, or poor countries, bad health systems, they failed. Poor countries have bad health systems. But now in this pandemic, the rich countries have failed health systems. US has failed, UK has failed, Italy failed. Spain failed. Holland and Sweden are failing in different ways. If some country in Africa were to adopt the same policies that Sweden and Holland, for example, choose, you would call them irresponsible, right? With what we know. So what I mean is that we have to have different metrics. So it is not the richness that makes a system that work, right? Your rich countries can also have failed systems. And I don't need to pick examples for that. And the question you asked, Pablo, sorry, I wanted to.
Oh no, that's all right. I was gonna ask, but I wanted to ask a follow-up.
Short term versus long term.
Yeah, but
yeah,
if you don't mind, regarding what you said, how, and this is a question I wanted to ask you later on, but might as well just say it out here because I will really appreciate your opinion on this. Now that we're seeing the world really polarized, how do we bring people to build a common agreement on what investment on healthcare system should be, or how to address these health determinants? And I would really appreciate all your opinion on this.
So the pandemic is still evolving, and this is in my lifetime, this is the first big major pandemic. So I'm learning, as you all are. We're all learning together. But my first impression is that we need global solidarity, global, all of that. But don't make the mistake that there is one approach that will work everywhere. So you have to have room for different approaches. So Sweden tried a different approach. Italy and Spain tried a different approach. South Korea, where I'm speaking to you now from, tried a completely different approach, right? So they have all worked to different degrees. So the response will almost certainly be local, and it has to be local because there are so many different variables that have to be taken into account to make a pandemic response successful. But that will only work if you have global solidarity, and some of the issues that Mokhtar talked about, that if you want access to PPE, testing, vaccines, future treatments, that people won't have access to it unless there is a global agreement, because otherwise it'll be, going to Target on Black Friday. People will be jumping over each other to, get whatever they can. It'll be just a mad rush for things. So global solidarity, global sort of compact is important, but we also have to make a lot of space for local, very locally specific responses to what is a global pandemic.
All right, thanks a lot, Dr. Unni. I think this is also going to be really helpful for the next panel. We have only, let's say, 5 more minutes in order to try to bring some conclusion into this question, and then I will give you each 30 seconds if you want to raise one last point. No, it's not a lot of time, and there are a lot of questions we could be debating here for hours. But if you, Mokhtar, want to start by kind of adding your opinions on this idea, then we move to Iris and last Fatima, and then we bring this final conclusion. All right?
So just to follow up on what Dr. Unni, he brought up a very good point that we need a global effort. Countries need to work together in order to be able to face this current virus. Like we live in a world that's so connected and so global that each country decides to close down its border and not talk to anyone else. This is how we fail as nations. And an example of the US, it's a very terrible mistake what we've been doing by defunding the World Health Organization and cutting all ties with them. The entire mentality of working together with other nations and coming together in unity is definitely crucial. And if anything, this pandemic has taught us is that it's as dangerous, if not more dangerous than war, because war, at least you know a geographical location of where it's going on. But this virus is an organism that can spread across different nations and just cause a lot of morbidity and mortality across the world.
Yeah, I would just quickly add just one more thought to this conversation. I totally agree with what has been said by both panelists before. And I would like to add that even though we see examples of polarization during this pandemic, I would also say that we see incredible examples of solidarity between countries. So in the general sense, this pandemic has really increased my optimism when it comes to global solidarity.
I think another point that Dr. Unni highlighted that is very important to me is the kind of when he was talking about like the stamina or the rate at which countries react, because on a personal level, I've noticed that this is kind of what differentiated Nigeria as a country from Senegal. So Senegal was prepared essentially because of the Ebola outbreak, and Nigeria is supposed to have also been equally prepared. They also had isolation centers and everything, but what differentiated the cases in both countries is the rate at which they reacted. So I think it's a very important point to highlight because, like Dr. Unni was saying, this is essentially what kind of created the differences in the results that we're seeing to the pandemic. And yeah.
All right, really interesting points you made here. Thanks a lot. I will ask you if you want to add just a few sentences to kind of sum up or any point you want to raise finally. And Dr. Unni, we don't have time here, but I would like to ask you if you want to ask the youth delegates here any questions, so we could maybe try to start building on later on after this debate. So if you want to start by that, and then I will ask everybody else to 20-second stops, because we're sadly running out of time to sum up their ideas. Thank you.
No, I was reading an essay in The Guardian recently, and this person made the point that she looked at previous pandemics, and this really successful responses had one key factor, that was mobilization at the society level. And this is not government effort. This is nothing to do with global governance. It's how people at the very grassroots level have come together to address the problem. So to highlight or to support what Iris said earlier, like in India, we are seeing the government is not doing anything, so people are coming together to feed large numbers of workers who've been stranded without a place to stay, far away from home. And I heard on BBC today how food banks are getting the highest ever contributions in recent years in England. So a lot of people are donating money to feed people who may not have. So there's a lot of incredible examples of local solidarity, and that I think will make the big difference how we cope together with a little bit of compassion and with a little bit of resilience and all of that. The coping mechanisms, we'll cope better as a society if we can all sort of come together and help each other. And that's where the young people play a lot, because a lot of these initiatives have been started by young people who have an idea and who have the energy to follow it up, and they make it happen. So I think you guys all have to, there are a lot of things to be done, and get started.
Definitely, that's a great point to start with, and I think it's really important for the next panels. We're gonna talk not only about global governance, but also about youth participation. So we got just one more minute. So for the rest, if you want to add 20 seconds and raise a final point, please go ahead.
Sure. Thank you so much for having me on the panel. Also, thank you to the other panelists for this very interesting conversation. And Dr. Unni, to see you again after seeing you in China as a Schwarzman scholar. I would like to end by saying that we see that social determinants affect all health issues. COVID-19 is really an important example that is showcasing this. Let's learn from the current situation, work towards achieving universal health coverage, which is an important aspect, but also towards preventing and preparing for future crises such as these. but also such as the even more far-reaching health crisis that is climate change.
I'll if you want to go ahead, like 20 seconds, please.
So thank you all for this discussion, for all everyone who spoke, and Dr. Unni. I just think that us as future healthcare workers, we have like a moral responsibility not only to lead in our careers as future healthcare workers, but also as advocates and activists about these issues to ensure a safer world for future generations. And I also want to take a moment just to point out the racial injustices that still is taking place everywhere around the world, like we've seen recently with the current events. I think as young professionals, we have a moral obligation to stand against all racism in all its forms and proactively speak and educate those around us to end any form of racism, basically. Thank you all for hosting this. It's been a great discussion.
Thank you very much, Mokhtar. And Fatima, if you wanna finish this round.
All right, thank you for this informative session. I think a very important point that Dr. Unni highlighted was the local solidarity, because I'm sorry I keep referencing Nigeria, but because this is the only thing that I know that much about, but I've noticed that in one of the cities, for example, the main issue was that people don't even believe that COVID is real, so people did not act normally. So I think health literacy, as I think Iris mentioned before, is very important when it comes to that, in that if people were even educated and understood what that was on like a local level, then this could have helped very much. So I think moving forward, it's very important to always try and ensure that, especially in countries where the literacy rate is very low. Thank you.
All right. Well, thanks a lot, all of you, for participating. I think it was really enriching dialogue. I wish we could stay longer, but at least we try to build the first framework from which start working on. I just wanted to sum up a couple points. First of all, that health is not only technical, it is also political. And that means that we have to involve ourselves. And in order to give the word to the following panel, the importance that you all have raised here of solidarity. If you want to get out of this situation and become a better society, we have to do it by working all together, and we need solidarity between all the people. So once again, thanks a lot, everybody, for participating. I hope we can see each other soon. And I will give the word to Rami, on the next panel, which is going to be about global health governments. Thanks again, and I'll give you the word, Rami.
Yeah, so thank you so much, Pablo. If I may ask everybody from the previous panel to close their videos and everybody from the next panel to open theirs, that'd be fantastic and wonderful. So we're going to be talking about cooperation between health actors and global health governance, given the advent of a new age, right? COVID-19 is forcing us to reimagine health systems, and hopefully for the better, right? And so this panel is really trying to understand a little bit more the changing of the landscape. So we're joined by multiple different incredible people. First of which is Leith Greenslade. She's the co-founder of Just Actions, as well as the coordinator of Every Breath Counts. This initiative really supports bringing different health actors together in order to combat childhood pneumonia. And most recently, the conference was taking place in Barcelona. She's also an advisor to Women in Global Health, and is a staunch advocate for the involvement of youth in health endeavors. We're also joined by Victoria, and her fruit is pineapple, which is actually comprised of various different berries. And so secondly, we're also joined by Victoria. She has an MA in International Relations and Diplomacy, and she's from Bavaria originally, and her fruit of choice is pomegranate. Next is Asraf Faris. She has a PhD, she's going to get a PhD in cancer biology, and she's also working hard as being a part of a national policy-making repertoire. And her choice, which is very daring, is durian. So that's a very interesting conversation to have later. And fourthly, we're joined by Ivan. He has a BA in International Relations and is currently an associate at the Health and Social Policy Division of CREAP. And his choice of fruit is apple. And last but not least, we're joined by Elise Nosef. She has a BA in International Affairs and Diplomacy and is a human rights activist in the MENA region. Her choice of fruit is also the apple. And so with that, I really wanted to kind of bring the conversation first and foremost to really situate it into data. So 52.4% of our respondents to the survey thought that national governments have the responsibility to combat the global health crisis. And actually the rest were mostly divided between civil society and international organizations. And so the question that I want to launch with is, what do you think, who do you think has the responsibility to address the consequences of COVID-19? I would like to yield the floor first to our youth delegates before moving on to you, Dr. Thank you. So if any of the youth delegates just has an opinion on this, please.
Can I start first? So hello, everyone. Thank you very much for having me, first of all. So yeah, coming to your question, I think it's not only the responsibility of our governments, but it's the responsibility of everyone, because we come from various countries, and each countries have their own governments. And to be honest, some governments are fair to their population, but not all of us have good government. So yeah, I think it's also the responsibility of the people as well. I come from Iraq. In my country, it was a shock for the people, the coronavirus issue. The country was not prepared, to be honest. But then, because of the several activists, several NGOs who helped, who served as volunteers to also raise awareness on the issue. So without them, I don't think the government was going to be able to make the people aware about the issue, or even raise the screening and the sterilization throughout the country. So yeah, I would sum up by saying it's everyone's responsibility. We cannot just focus on the government or the NGOs. It's the responsibility of all. Yeah.
Mm-hmm.
Hi, everyone. As Asra said, I agree completely with her that it's the will of the people and the government, as well as the international community, to work together and to fight the COVID-19. I can give you an example of Lebanon. Not only did the government respond quickly, but not quick enough, but the will of the people and each individual in Lebanon, they contained and they locked down themselves in order to ensure and contain the outbreak. And in addition to several NGOs that were raising awareness, and the UN, UNHCR that have raised awareness in the refugee camps, knowing that Lebanon has a huge ratio of refugees in Lebanon. Thank you.
Thanks for having me, everyone. I also wanted to say, yes, the national players have an importance in tackling the crisis. But on the other hand, we also have to think of the international organizations, and especially the state unions, like the European Union, where I live. So it was really a point of, we can see now if this union is functioning. We are all trying to tackle it somehow. Germany was more lucky than other states in Europe. And this is why we really need to show the people that we are also interested in the other states and in working together to really give the money from one country that was more wealthy the years before, that had a lot of luck with not having the first infections and so on. Yeah, and this is why I think all levels are kind of important and responsible. Yeah.
Hi everyone. First of all, thank you for letting me be here. I fully agree with the points that the three colleagues have made. I think, and following up from the other panel, we should first think of what particular responsibility we are talking about. we cannot attribute and we cannot make the same demands to the states, to international organizations, or to the local governments or regional governments. So I think we should bear in mind what particular thing we are talking about. We cannot only say this was the fault of, or this should have been the responsibility of the states, because it depends on what. If we are talking about coordinating policies, perhaps we can focus on, as Victoria said, for instance, I'm talking from Spain, the European Union or international organizations, but we should not, I think that's the lesson I learned also from the other panel, forget what's going on at the very local sphere. No?
So this is the key question, the global governance question. And I think the pandemic has exposed a real flaw in the way we organize ourselves as humanity. So the nation state is at the moment the body responsible for health crises, but I think we realize the nation state more and more is ill-equipped to deal with these big global challenges. The pandemic is just one, but we have climate change as well, which is a problem and no nation state alone can solve. So the question is, what kind of global institutions do we need? The current crop we have were all built after World War II. So all the UN agencies we talk about, they're actually very old. Are they fit for purpose in this new environment where we have pandemics and climate change, dramatic inequality within and across countries? So I think it'll be the challenge of your generation to redefine these institutions. I think this is going to be something that will be a major part of your careers, is how we do this. Can you reform the WHO, or do you need to rebuild some totally new institution? My own view is that the nation state is waning. And as we become more connected, we will lose the need for strong national governments, and we will need very strong regional and global governance. And what should that look like? If I was starting out again, my career, that's a question I would really want to get my teeth into.
Yeah, and really on that note, I think it perfectly kind of segues into the next question, which is, how do you think the global health order has failed, if at all, in its mission, and what aspects should be improved? I think that at the end of the day, for example, regarding the WHO, it came out of, similar to what you were saying, the kind of Second World War order. And very importantly, I think to, for example, Ivan's point, where we're asking what exactly is it that the WHO is even trying to accomplish, right? Like it's confused between its technical and coordinating role. And so how can we really define what are the failures, if at all, of the current global health order, and what aspects should be improved? I'd really like to hear everybody's opinion on this, because I do agree that moving forward, it's the most pressing challenge. And yeah, so.
Hi, hello everyone. Regarding the WHO, I think its late response to the pandemic, to make it a pandemic world threat, to announce it as a world threat, played a definite role in different countries criticizing WHO or criticizing its state regarding, stating that it is a world health threat. And as for the could you just repeat please your second question, just for me to answer?
Oh yeah, of course. So we're just trying to understand how the global health order has failed, if at all, and what aspects of it should be improved. Because at the end of the day, it has a lot of different kind of aspects to it. For example, including private-public partnerships, different elements that we had kind of given to you in the knowledge pack. Yeah.
Okay, so basically, we have had a lot of warnings from the 18th century until now regarding flus and pandemics and diseases, and the international community and nations have not focused and invested in order to enhance their healthcare system or to create new private-public partnerships, or to enter private-public partnerships, or to raise the standard of their healthcare. Instead, they have focused more on investing in and fighting man-made threats, instead of investing on healthcare, which in return will like stabilize their economy and all. And the reason why a lot of countries like waited to respond to the to respond and to state a lockdown, a state of emergency, etc., is because they were afraid of losing their economy, rather than being afraid of the death toll that will take place in their own country.
Mm-hmm.
That's it for me. Thank you.
Yeah. I think that you make a very interesting point regarding kind of the investment of national governments in really tackling man-made threats more so than things that are actually imperative and also global, right? For example, you have this pandemic, you have, for example, climate change, similar to how it was mentioned originally. So yeah, anybody else has like comments on what Elise had said? Yeah, Victoria, please.
Well, I think in general, we need more attention on health in also moments of no crisis. So for my country, for example, we did not have experience from many other epidemics for long years. And I think especially for the WHO, it is important for private and also public-private organizations to jump in that place when nation states fail to understand how important health is and that we cannot take it for granted. So for me, it's always important. If I see my last internship I was doing at BMW, and BMW did not sell many cars in the last time. So they completely shifted to making masks and so on. So I think we really have to come together with all actors and make them also responsible in the WHO to support what the WHO is doing, and to raise awareness on the issue is global, and if wherever a virus spreads again, it can hit all of us. So we have to listen to the others. We have to have task forces that talk to each other, that discuss what is going on in the different regions, and that might be my answer.
So I really like what you're saying about kind of nation states to a certain extent focusing on themselves and then realizing that that's not the way forward. And so, like, I think you have a lot of experience regarding kind of public-private partnerships and the difficulty also that comes with it. And there's also the question of, is the WHO even the right health actor to centralize and to think that they should lead the global health governance movement? And I think that I would just like to hear more about kind of your opinion on this and regarding kind of the different comments that were made by Elise and Victoria.
Well, there are a handful of very powerful global health agencies. It's not just the World Health Organization. And if you saw yesterday, Gavi, the Vaccine Alliance, raised more than $8 billion to vaccinate the next generation of children. And they did a virtual summit yesterday. And honestly, it was so inspiring to see world leader after world leader at the head of state level from so many countries in every region across the world, zooming in to talk about their contribution to child health. So this was an example, I think, of the world's children bringing nation states together. So I'm a huge believer in that kind of effort. Gavi is a public-private partnership. The World Health Organization is not. The World Health Organization is a sort of a creature of the nation state. You can question that. You can say, well, do we need a World Health Organization that is not just reflective of nation states, but that is a more democratized entity? I think you can ask that of all of the United Nations agencies, which were set up by governments. How do we democratize them? You know, I sort of dream of a UN 2.0 that would have a much better connection to the people. I mean, we don't vote for UN leaders. We vote for our national leaders, but we don't vote. Should we? Should we have a system where we can vote for the head of the World Health Organization? And how could technology enable that kind of massive electoral system in every country? I hope we can get to a point where we can elect and vote and have a direct stake in the global governance architecture, but we're not there yet. Your generation will have to build UN 2.0, and I hope you do.
Yeah, and I think that's a very interesting kind of example where you have Gavi really being, to a certain extent, more effective in its mission than, for example, the World Health Organizations and other kind of partnerships. And I think all of our participants also are aware of it because we had included it before. And so I think it's a very interesting question with regarding to embedding technologies into global health governance, and also to what extent does that play in with, for example, public health records, public health cooperation. And so what form of kind of collaboration should exist within the field of kind of embedding technologies between health actors in like national kind of governments? Or more concisely, what is the role of technology in the future of global health governance in your opinion?
Can you hear me?
Yeah.
Sorry, thank you. I'd like first to go back for a second to the previous topic. Sorry, Rami, I'll answer the question briefly, because I think it's really important what you all said, and I fully agree to the points you've made. I think in order to land that question that you were previously making, which is the future of this global institutional framework, the key question should be, which is the role private actors will play here? And I've been very hesitant about it. I like to share with you my hesitations, and I don't think there's a clear answer. But in the end, I think I'm very much in favor of a global of public-private cooperation. I think we're also seeing it at the national level when tackling the pandemic. Companies like Victoria was saying are helping a lot too. I think what Gavi is doing right now, these days, it's also really interesting. But the interesting point is, who has the legal and ultimate responsibility? And this is a question I would like to also share with you and that I make to myself. Should we bestow a responsibility for a global public good as is health to a private entity? Or should nation states be the sole and only responsible for that? And I wanted at least to share that reflection with you, because I'm not fully sure of which answer we should give to this one. And briefly, just Rami, to go back to your first question, I think technology is key to democratize organizations. But first, I mean, I feel it's quite difficult right now to make that democratization wave whereby using technology to be something that can be possible bottom top. I think there's so much resistance in our representatives right now, no?
Yeah.
Those are my
thoughts. So we have about 7 minutes. We have about 5 minutes to discuss kind of the different questions that we have come up so far. So if anybody has kind of a comment that they want to say about the democratization of global health governance, which is a very interesting concept that Leith just brought up, it'd be lovely to kind of hear more about that. And yeah, like Ivan, the question you're posing is kind of, should we even kind of let go of that global health governance responsibility to a private entity, or should we kind of have something similar to the WHO where it's multiple different nation states? But yeah, so however you want to take the conversation moving forward, the democratization of global health governance is a very interesting discussion. Elise, I think you were going to say something earlier. I'm not really sure. Sorry to call you out.
No, it's okay. I was thinking about the democratization of health governance. I think it's a good idea, but the citizens of each country, they vote for their representative because they trust them, even though afterwards they fail and they neglect the trust. But at first, we vote for them because we trust and we give them trust. If a certain, like a think tank or a union of the different healthcare, let's say private corporations and public corporations were to come hand in hand, like Dr. said, the WHO 2.0, and they were voted on by our representatives from our nation, I think that would be a great idea. Honestly, I think it would be the future of global healthcare, where we would have in this let's say the think tank or union, we would have different perspectives on healthcare, how we should continue with this method or that method and study. I think it would be the future of healthcare from my small knowledge on healthcare. Regarding the technology, I think that South Korea, I'm not very sure. It was the main country using a technology to detail and to track patients of COVID-19. And what I've been reading is that they've been doing a great job, but also there is a repercussion, technology and privacy and all that. So to a certain extent, I agree that technology should be used, but with limits, of course.
Yeah,
thank you.
And that's actually a very interesting thing that we found in the survey, where about 60% of people had kind of wanted public health information and data to be shared between countries in order to kind of enhance and essentially emergency responses. So I think that's a very interesting question about how embedding technology can also, to a certain extent, compromise the democratization of global health governance. I don't know. Yeah, Asra.
Yeah, again, back to the point of technology. So yeah, I think it's very important. But then if you think about it, who will be able to use the technology? Like, because we have different countries, there are poor countries, there are rich countries. And so of course, like many of the countries would be able to use it, but what about the poor countries? And there are many countries that are even going through wars. Like right now, there are so many people dying because of COVID-19. But what about the wars that are going on? Like there are so many innocent lives that have been taken, not because of any virus of anything. It's just innocent lives that are just like, they don't even know when their day comes. It's like you wake up and you don't know if you're going to make it for the next day. So again, it is important to have, I guess, like first a UN 2.0. First, we need to erase all the hatred, all the discrimination, and then we can focus more on health. Health is very important too, but there are also like many people dying for other factors that they cannot even control. Like we can't control the health part, but what about people that, like, I know it's out of topic, but then still, because like I come from like Iraq, it's our affected country. There are so many people now, they know about how important the COVID, but they break the lockdowns. They don't really comply with the curfews. If we ask ourselves, why is this happening? It's because these people are not living, like their countries don't have laws. So I think it's also important to look into that and try to come up with something like, like that every country should unite, and we need to remove all the differences and stuff. And then, yeah, it's important, of course, to come out with technologies and sharing all information between each countries to learn from, like what works in one country may also work in other. And yeah, so yes, that's my point.
Yeah. I think you just made a really beautiful crystal point about building inclusive global health governance, right? And so you're thinking about how can you leave no one behind in a kind of a global health governance system that works. And similar to what the word that we're using is like the 2.0, right? Like the reimagination of kind of how global health governance should be. And so unfortunately we have about 2 minutes, a minute and a half. So let's just do a lightning round of kind of final thoughts before Leith can kind of give us a little bit just final thoughts about where the youth can kind of put their efforts in reimagining kind of global health governance. So Victoria, can we start with you? And so yeah, just short and sweet at the end of the day.
There are so many different points youth can get involved in this crisis. I think that the crisis is especially showing us what problems we have to work on clearly, more clearly than ever before. So if I, for example, think of women, how they are affected by COVID-19, I think that we have all young people stand together and talk about the smallest things of discrimination against women, especially if they are so hit by the virus because they are at home caring for the children, because they are more more likely to be now discriminated or also hidden by men at home. So I think this is very important to really think of the issues that are key to you as a young person, and then to stand up for those issues and to involve in local politics, but also to go up to a level to discussing how we do overall borders, to really understand and to know that you're living in a country where it's working, and there are other countries that are always worse off than you. So that is something I would keep in mind. Yes.
Yeah. Perfect. Yuan?
Yeah, well, thank you again. As for the point you made, I fully agree with you, and thank you for raising it here. There are just three main points that I was writing down to sum up all this reflection. The first one being, I think the spotlight is right now in the pandemic, and we have to try, despite the harsh news, to look beyond that, because the reform of our global governance in terms of health should attend also to primary healthcare. I think we really need to update instruments such as the Declaration of Alma-Ata, which are quite out of date. And lastly, I think I would really like to point out the importance of the regional sphere, of regional organizations, because they can combine this global coordination we were discussing now with the effectiveness of the local response. I think they may be interesting fields to talk about.
Perfect, thank you. Asra?
Oh yeah. Again, thank you for having me. And one last point, I guess it's like also like whatever is happening is really bad nowadays, but it's a great opportunity for us to learn from whatever happened, to learn how we can improve our healthcare systems in all the countries, to learn the importance of sharing knowledge. And it's not only about competition or blaming which country is responsible for whatever is happening, but it's a great point to learn of how we can improve, hopefully, and hope that this doesn't happen again in the future. Yeah, thank you.
Perfect, thank you.
For me, I think that for the past 5 years, we have seen how much the youth is very powerful, whether tackling climate change or other issues in their own nations. So I think as the youth regarding healthcare, we should lobby and raise awareness in our own communities and lobby our representatives to create policies and enhance our healthcare, and in order for it to be affordable for everyone. Thank you.
Perfect. So last word, please.
Okay. So the stakes are really high here. We've seen what the pandemic has done to almost every country in the world. So we know that these health challenges, when they go wrong, can be devastating. So just remember that the institutions that we have now at the global level and the national level who are trying to deal with this crisis were largely built after the Second World War by groups of men, to be frank, older men, usually white men, from very small, elite groups. And these are the institutions we're still working with. So where were women? Where were youth? Where were leaders from the global south? All missing in the way these institutions were designed. And that's why you can feel in every country this sort of, certainly here in the US, I'm in New York City at the moment, this groundswell of the people saying these institutions are not fit for purpose. They don't work for us anymore, and we want fundamental structural change. I encourage you as young people who will be involved in health, be bold in the way you reimagine these institutions. They don't need to look like they look now. But what I'm fairly confident about is if young people can build transnational movements, like if Generations for Health can become a truly global dialogue with young people from every country participating, getting bigger and stronger and more influential, you can change the way these institutions work. It won't take place tomorrow, maybe not next year, but if you keep at this for 5-10 years, you can truly reshape these institutions so they work for people and for universal health coverage. So thank you for having this dialogue. I hope we have many more.
Yeah, absolutely. And I think that really that crystallizes it, right? To be bold together in reimagining not only global health governance, but also our own local kind of health systems, and where the youth can kind of really pull their efforts and really be bold in their kind of reimagination and in their daring kind of pursuit of making kind of health not only something that's inclusive, but also something that's affordable. And that perfectly segues us into the next panel, which will be on the role of youth. It will be facilitated by Daryl Alvarez. So everybody who's in this panel, please close your cameras, and everybody who's in the next one, open yours. And once again, thank you everybody for joining us so far.
Well, thank you so much again for all of you to be here. I'm very excited to be facilitating this panel. It's a panel that I really love. So first, let's start about introducing our amazing participants in this panel. I'm gonna share my screen for a second. Okay, so let's start with Dr. Stefan Peterson. Dr. Stefan Peterson is a public health physician, professor of global health, and the chief of health section in UNICEF Global. And the fruit that describes him is the pineapple. Emily Liao is a 9th grade student from the United States. She's a youth activist in different movements and programs such as the Youth Government and the American Civil Liberties. In the fruit wall, she is a cherry tomato. Jesus Cordero is a data protection officer and lawyer, and he's the founder of UNSA Granada and UNSA Spain. The fruit that best describes him is mango. And finally, Kilian Marcelo Chavez. He's a student of psychology and the leader of the foundation TB Redent. The fruit that describes him better is a strawberry. Okay, I'm gonna stop sharing my screen, and I would like to start with something. We have seen in this pandemic that there has been a lot of initiatives led by the youth to help their communities during this crisis that we are facing right now. I would like to first start with the youth. We're trying to change a little bit the stereotypes. So Stefan, don't be mad at me, please. We are trying to break a little bit the stereotypes about the typical conferences in the youth first ask questions to the panelists. So we are gonna give all the time the word to the youth first. So how have you seen the role of you regarding this pandemic in your communities? How have you seen that the youth have been contributing in to help their communities during this pandemic? Why don't we start with Emily?
Okay, as you all know, I'm kind of like the youth of this panel. Like, I'm only 15 years old. I go to high school currently. I'm a first-year student at high school. And recently, during this pandemic, I've just seen my peers grow so much and kind of own up to who they really are and kind of what's going on within our nation. You know, oftentimes young people are overlooked because we don't really have, like, especially in the USA, there's kind of a generational gap, right? And so we're not a voting age yet. We're not, you know, we're kind of underrepresented within our government, and we don't feel like we have any reason to give our voice or opinion. And so a lot of us just kind of shy away from the spotlight. But thanks to like this, but by this pandemic and by other like stuff that's happening, I stated in the previous panel, you know, institutions are being like we're just kind of realizing the fact that some institutions are outdated, and youth have such an important role in that because they're kind of speaking for how they feel about the entire thing, because there's gonna be one day in the future where we have to kind of take charge. We have to be the ones to kind of go on and, you know, rule these governments, and we're going to be the ones that have to be in positions of power. And why not start now? It's awesome to see so many advocates and young people kind of going to the streets and protesting and marching for things they believe in. Yeah, so that's what's been happening for me.
So Jesus, how have you seen like the young people contributing in your country to solve the challenges that their communities are facing in this pandemic?
Okay, thank you, Daryl. I would like to start to answer your question, pointed out a couple of ideas that have appeared in the previous panels. One of them is to assume and to understand the need of the mobilization of civil society and the need to empower ourselves as youngsters and being part of the solutions that we want to make it real. Linked to that, we need to understand that global challenges need global solutions. And now, after having this reflection in mind, answer your question, what I have seen, at least in Spain, is that when youngsters organize, it is a completely success. Let me tell you all an example of that. Cuando volvamos, when we come back, it's an example related with economy. It was a private-led initiative run by 50 volunteers from all over Spain. They helped more than 500 local business in helping building more than 100,000 euros in 3 months, giving incentive for people to buy service packages in advance, like meals, dinner, whatever. The idea of that was to help these companies to stay open. So that initiative was copied in many cities councils all over Spain, and it was a success because it was organized and youngsters were empowered and were ready to make a change.
Thank you so much, Jesus. I think you made a very good point. Kilian, I know you are the leader of a youth organization. Could you share with us how your organization have been contributing to combat the effects of this pandemic in the community and how other organizations in your area have been acting?
Thank you, Dorothy. We are citizens of the world, and therefore the responsibility to take action is ours. As young people, we have to recognize that our voice is important and we are a fundamental part of the change. So our role in the society is pretty important, taking into account that the majority of volunteers are young people between 14 to 28 years old. We can forget those things that make us human beings, such as the empathy. In that order of idea, my foundation was created to help people that need it and get to them with joy as a characteristics of the young people. It's important to mention that it's in comfort by a lot of adolescents. In the case of COVID-19, we have to create a social, human, and family network to connect people who really need our support. We are the real change. We need to form to everybody, generating awareness from our home, starting by our children, young and old people, because that is the purpose of life, serving and build a better world with no needs that are in our head on daily basis, making a risk factor worse than this pandemic. This health problematic can be an obstacle to reaching the goal. And my foundation, in this case, has a reason to solve this problematic and in order to decrease the fake news, because there are a lot of fake news. Currently, Problematic Mental Health has been providing campaigns and training about the life skills and the correct information about the virus with the volunteers and their families.
Thank you so much, Kilian. I think it's an amazing lever, the one that your organization is doing, so congratulations. And Stefan, how do you think the youth have been contributing during this pandemic? Can you give us some insights?
Thanks, Daryl, for having me. And I like it's called Generations for Health. And I obviously I'm of a different generation. And I think you're making tremendous contributions as youth. First, you decided to give up school. Then you decided to help out. And then you decided to pay for all the stimulus efforts that we're going to put into this so that my generation and all the generations benefit. I think you are incredibly generous. No, sorry, I'm pulling your leg a bit, in the sense that I think that youth in many ways are paying the price for this epidemic now and will in the future, with the recession, with the public debt we're taking up, etc. And I think we haven't consulted you in making these decisions for you. So my plea to you is actually to get in there and grab that opportunity and be an active participant. And that's why I think this initiative is great. But you need to take that space. And I think we've heard from the first panelist here saying that you don't vote. Yeah, but you will soon, and your parents vote, and you know people who vote, and there's 1.8 billion of you. So get in there and take that space and start demanding that the young people get the recognition. And I would like to say that as we build back now and we decide to spend essentially your money through huge public stimuli now, that we build a green future that is sustainable. Because if you recall, there was a big youth movement for planetary health, which still goes on in the virtual sense. And in my plea to you is link these up. There's never a better opportunity than to build back better now, which is for the COVID, yes, but it's for the future. The COVID, if you look at the longer term, COVID is terrible now, but there are bigger health threats as there are now, and there are huge health threats around the corner. So make sure that you as young people, because you are the ones taking over this, you're paying the price for COVID, yes, but you'll pay an even bigger price for the planetary emergency around the corner. So get in there, curate your voices, join up these youth movements and grab the initiative. Over.
Well, it is clear that the youth are contributing a lot during this pandemic, but what do you think are the main challenges for youth participation regarding the right to health and access to healthcare in your countries and communities? What would you think are those challenges that the youth are facing for that? Jesus, why don't you?
Okay, Stefan is talking, or may I talk?
Go for it.
Okay, I go for it. I'll try to sum it up, the thoughts that I have in mind to answer your question, like in two main ideas. First of all, I was telling before that organizing is a key asset for youth to impact and to provoke a change. But to organize properly in a scenario like we are experiencing right now, with a global crisis, we need to organize using the technology as a key ally and designing scalable solutions, acting in a centralized way. We see example of that, for example, in Cuando Volvamos initiative, the one I was telling you before. We also see this example like in this project, Generation for Health. We are acting in a centralized way, with a global vision, and using the technology as an ally. I would say, yeah, I will sum it up with the risk of using that technology properly, because we were talking in the last panel that we need to have an ethic view on technology, but also to get rid of the gaps of the access to the internet and tech infrastructure in many regions that doesn't have our same capabilities like in Western world. I don't want to take more time, because I know it's 1 minute to its contribution.
Thank you so much, Jesus. Kilian, do you have anything to add to that?
No, I don't really, because young people have the answer in their hands. Love, serving, and altruism. Three factors. Love, serving, and altruism is like a protective factors through local and global volunteer, understanding that the essence of you is found in the little things that are done with love is the only answer to shape a better future. I think we have to create, or we have in our hands the real change, because we have to work together. We have to work in a light rhythm, in a light symphony. In relation to the above, Colombia, it seems was such a silent war between social classes and the community and lower classes, and the initiative have to work in the life skills and the real factor to protect, to help people and support the people who needs our hands, because all of us are get involved in this pandemic.
Thank you so much, Killian. Emily, I would also like to hear your opinion on this. You are only 15 years old and you are here raising your voice for the youth. But I would like to ask you to be a little bit critical. For people of your age, what are the main barriers and challenges to actually be participating and raise their voices on important issues such as the access to healthcare?
Yeah, for sure. First, I'd like to kind of talk about how, like, the kind of, again, the gap. We have these huge institutions, right? Healthcare. We have, this sort of iron triangle that is formed in USA, where basically it's the bureaucrats, and we have Congress, and we have lobbyists, and together they form this unbreakable bond where nothing gets done. And then we have the youth. We feel small, we feel belittled, and as Stefan said, we're kind of at this crossroads where we can kind of go forward and try to reform these huge institutions to fit our current generation and the generation that is going to, be the next leaders, or we can just continue down the same, road that has always been. And it's kind of, every single step and every single decision we make as youth is going to completely impact like the world's history. That's kind of crazy to me. Like it's weird to think that every single one of us has a footprint that we're going to leave, And I think it's now more than ever that we need advocates and we need people that are willing to raise their voices. And I think I found that within my own age group. And we just have to continue raising our opinions about things and not be just not stopping. That's the most important thing. We have to be willing to go that extra measure.
Thank you so much, Emily, for your insights. I think you're very right. Sometimes that gap between international organizations and the youth makes feel the youth that what they are doing sometimes may not have an impact, but it actually have an impact. Stefan, what do you think about our youth delegates have said so far?
No, I think you're perfectly right. And I think, so go for it. I think you're making individual contributions, you're making collective contributions, but I think you need to amplify your voices. Get the technology behind you, get in there, curate the voices of the youth, take the political space. It might not have been built for you, but those are the opportunities for change. And yes, the nation state is a bit outdated, coming back to Leith's points, but it's one of the levels we need to work. The city and the city level might be a more nimble, and then in the local community, as many of your initiatives show, that's where you can really make a difference. So organize, take political space, and get out there. That's my view. And actually try to link up whatever you're doing for COVID in the short run with how we build back and the opportunities for a sustainable future that will serve your generation and coming generations, because it's really that bad. European climate data came out today showing that in May, Siberia was 10 degrees warmer than the historical average. And that means the methane is coming out. And the methane is a huge catastrophe. So by all means, let's build back better. And you are the biggest youth generation ever. Get your technology organized, link up these movements and take space.
Thank you so much, Stefan. I would like to ask you something. You are the chief of health of UNICEF Global, which is a very big organization and belongs to the United Nations. What mechanisms and ways is the UNICEF and the United Nations creating to promote the participation on youth on health matters?
Well, we've devised a couple of methods, and if I can ask your colleague to put up a slide. We actually prepared some of the mechanisms that we have at our disposal. Mind you, there are people who are younger than me who work in UNICEF, the United, but they are still, of course, older than you guys. So these are some of the mechanisms. Oh, it disappeared. These are some of the mechanisms that we could think of, and the people who work with me on adolescent participation. So by all means, use those. But I'm asking you to innovate and make your own as well and take the space. But I don't know if we can get the slide up again. It had a couple of suggestions for what it is you can do to get involved in something, in raising your voice. We have something called You Report. We're collecting something called Voices of Youth. There's a call to action for adolescent health and well-being. There's an online service here on your health in the current crisis. And then you can see, I think if you're on this seminar here and if you're listening, you're an aspiring young leader, and please get in touch with Tanvi on the email address you see there to get on our lists. But by all means, don't wait for us to take the initiative. You guys are the ones with the initiative, so create your own and make us follow you. But meanwhile, please welcome to join these opportunities. Thank you.
So one of the things as a youth activist also that I have realized is that there are a lot of mechanisms that are available for us, but a lot of times we are not aware of them, even at local level. How do you think, what is the problem? What do you think is the problem? Is that the international organizations are not able to communicate well to the youth? Is because of that gap that Emily was talking about? Why do you think sometimes these mechanisms don't reach us? Emily, do you want to add something on that?
Yeah, I think that especially following COVID-19, we're kind of separated as countries because we're all kind of trying to, deal with this global pandemic in our own ways. And I know that each country differs, as stated in the first panel. There are different health determinants, and those are different for each country. But within each country, we have very different, things that are happening, and I think that's part of the reason why we have to now more than ever bond together. We have Black Lives Matter movement going on in the USA. Just a few days ago, actually, I attended a protest and I saw an unbelievable amount of kids just my age, going there, and it was really inspiring to see that. And also, it was really inspiring to just be there and be kind of the voice and the change for the next generation. And I think that it's not just protests in the USA anymore. I see news about countries from all over the world joining in with us, to protest for the institutions that need to be reformed, need to be changed and adapted to our generation and what's going to come, because now they don't work for us anymore. They were built for white men. That's the basis, and we need to change that, because now our demographics aren't just white men. The people that are voting for our next leaders aren't just white men. The people of the countries aren't just white men. And yeah, I think that what we need to do together is just to bond as an international community and support each other through this pandemic and also the stuff that's going on politically.
Thank you, Emily. Jesus, do you want to add something on that? What is there a bad communication between international organizations and the youth, or do you think there is other problem why we don't sometimes get the knowledge about these mechanisms?
Mm-hmm. Well, sometimes it happens because of different communication problems or or the lack, of comprehensive strategies to cope with these different challenges that could have this youth vision. But I would like to point out a reflection after hearing on all these different inputs in this debate that is quite important. I think it's the critical origin of the problem, and it's something that Emily pointed out before. How do we feel as youth? And also Stefan talked about it. We always talk about youth like the talent of the future, or future change makers, or the future is ours. And I think sometimes we cannot believe that, and that disempowers us, because it's the present that needs our energy, that needs our will to innovate, that needs our action. Acting the present, in an organizing way, is the thing that provokes the change. So I think that one of the main problems is related with our mindset on how do we see our role in the world right now, and the lack of vision of ourselves, like the truly present change makers and the truly people in charge of dealing with the humankind challenge that we have, because we need to think that we are a humankind as a whole, not only a country. When we as a generation understand that properly, maybe we could engage in other initiatives.
Thank you so much, Jesus, for your contribution. Kilian, I will ask you to be brief regarding this question, as we need to finalize this panel, and I would like all of you to have your final words.
Okay, an important role is played by the youth. It is necessary to listen our analysis of what is evident and what happens in each situation about this pandemic, because young people have a lot of to say about the health crisis caused by COVID-19. They cannot be deception to change in this health problem. It is evident that the power that young people exercise over the masses represent an union and like a cry of hope that will mean that they will soon get out of this. So we can work together, and we are going to change the world, because I hope so that we can work in each country with each initiative by all people. Thank you.
Thank you so much, Kilian. Stefan, why don't you say your final words with us?
I'm delighted to be invited to this initiative, and I think it's a very important initiative. So I encourage you to actually link out, make the bridges to the planetary health movement or whatever it is, grow this initiative and make your voices heard, and let us know, tell us what it is you want. I don't know what you need. I don't know what you want. Grab it, organize, take the power. Thank you.
Thank you, Stefan. Emily, your last words?
There's this saying in Chinese, it's 火少年, basically means like there's like fiery youth. Basically, youth have a lot of fire within their souls. We're willing to kind of go and try to change things. And I really hope that, this generation can kind of live that out, go fight for their opinions and what they believe in. We can make some changes and try to reform some institutions so that we can build towards a better future for the entire world.
Thank you so much, Emily. Jesus, your final words?
I would like to use these final words to thank you all of the team of Generation for Crisis for letting us being a voice, not an echo. And I will steal the hashtags of Stefan to use it as a common claim to action for all of us. Let's organize, #organize, and let's #take the space.
Thank you. Kilian, whenever you want, your final words, please.
No, thank you everybody, because Dr. Stefan said we have the power, and we have to change the world. No, we can't. We have to change the world, and that's all.
Thank you so much. I would like everyone to turn off the cameras, but not Stefan. And I would like to Leith and Dr. Unni to turn on the cameras, as I have a very important question for you. Emily and Kilian, whenever you want, can you turn off your cameras? And Dr. Unni, please, can you turn on your camera? I would like to thank you again for joining us today. I know you have very busy agendas these days because of the current crisis. And I would like to finish with you saying, what piece of advice would you give to young people that want to become health activists and want to have an impact on the right to health and have a positive change in the world? What piece of advice would you give to them? Dr. Unni, if you want to start.
I usually don't like to give advice, because I think we all find our own way in our own time. When I was young, the big issues were apartheid in South Africa, famine in Ethiopia, etc., etc. And we engaged, and I think Stefan also engaged. We were all humanitarian workers, and we addressed problems, and we had some successes, and we had a lot of failures. You are facing new challenges. You're facing a world that is remarkably different in where it is at the moment than it was maybe even 20, 30 years ago. So you have to revision a world for yourself that is kinder, that is just, that's equitable, and then work towards it. Don't work with existing institutions that have failed to deliver. You have to imagine new. You have to go back to the drawing board. We talked about democratization. You talk about seizing the space. So you have to, don't go by the old playbook. You have to create your own playbook, and you have to sort of work hard at it. So that's all I'll say, because every generation has to find their own answers.
Thank you so much, Dr. Unni. Leith, do you have an advice that you would like to give us?
Yes, I do. Know who you work for, and always keep that close to your heart. So you shouldn't really be working for an institution, even if that's where you're based. You shouldn't really be working for an individual. You should be working for an idea or a group of people. I believe in health. So you could be working for universal health coverage, if that's your passion. Personally, I work for children and their mothers. So I work for a particular group of children. I always keep them in my mind. And every decision I make, no matter where I'm located or who I might be working with or for, it's that group of children and their mothers who I have pledged to serve. And if you think this way, you can actually have an enormous amount of impact in your career, no matter where you work, because institutions fail. And you'll often find yourself working with or for people who don't think like you do and who are difficult. But if you always keep your mind on the group or the idea that you're trying to serve in health, I think that can really enable you to do a lot of good for a long time.
Thank you so much, Leith, for your advice. I think we are all want to take it into account. Thank you. Stefan.
What can I add to these wise words? A mentor who was important for me said, health is made at home and hospitals are for repairs. And I think that goes back to your first panel today about health determinants, and that they are probably not to be found in healthcare. So I think that's one piece. But then I think you need to assess the challenges of this time. And I think, unlike previous, if you went back, you would have done malaria, you would have done HIV, etc. Today, I think we're again seeing civil rights in the streets now, but we're also seeing the planetary health challenge. We're seeing the urbanization issues. So I think you need to assess the situation. And I think what's unique now is that technology in some ways has enabled you to take a bigger space and to organize better and more efficiently than before. And so I think look at the challenges of your generation of humankind going forward, and then pick something that you're passionate about, and don't worry about where you're going to work. And that will always sort itself out. Thank you.
Pardon. Thank you so much, Stefan. I would like to ask everyone to turn on their camera so we can close the debate. I would just like to finish with a couple of words regarding to the advices that our experts in the field have given to us. I would just like to remind you that small actions matter, and that big changes start from small actions. And we should never forget the power that as individuals we have. I would also like to remember that the right to health is not just about ensuring access to healthcare, but it's also about environment, education, gender equality. It encompasses so many factors that all of us can contribute to protecting and promoting the right to health. And in that regard, all of you here have already taken the first step. Some of you have already taken so many steps that you have been very active in the field. And I would like to encourage you and all our viewers to keep on fighting for the right to health. This is just the beginning of Generations for Health. We want to build a community around youth activists and youth leaders that want to make a change in the world, and we want to give you the support. So welcome to the community and to the family of Generations for Health. We are very happy to have you all here today, and we will always give support to institutions like Every Breath Counts, UNICEF, Doctors Without Borders, the World Health Organization, to find ways to engage better with the youth and to amplify your voices, because your voices are important. Thank you so much, everyone, for being here today. We are very grateful. I'm very happy with the outcomes of the debate, and thank you. We are gonna finish the live, but I will ask you to just stay for 2 minutes. And thank you so much. Rami.